Hello, I'm Dr. Obey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, we're here again, and I'll emphasize caring and sharing. Remember, caring and sharing is so important when you're talking about health, because it's so important to understand that you may need to take a friend or a family member to the doctor. You may need to be able to some assistance with someone who needs to take their medicine, laying the medications out for the week to make sure that they don't miss. It is so important for each of us to help each other stay healthy. That way, we all have a chance to live that long, glorious life, to get old in good health. Well, check us out. Facebook, ObeyYourDoctor.com. And that's the website, but our Facebook is Obey Your Doctor. Twitter as well, Obey Your Doctor, and we're on Instagram. Check us out. We have a lot of health information on all of those social media. All righty, let's talk. I'd like to talk about menopause tonight. What is menopause? Okay, let's just break it down very simply. It's when you have a decrease in certain hormones, and the two hormones that we're talking about are estrogen and progesterone. All righty? And menopause can cause a few little strange things to happen too. You can have a lot of anxiety sometimes, females get depressed sometimes, or mood swings, and you wonder why someone in that age range is having mood swings. It may be because of menopause. All right, so what we can do about menopause is a factor that I'd like to talk about this time. We can adjust our diet. We can also increase our activity, and these things just may help. Let's talk about that. Calcium is very important. It prevents bone loss during menopause, and that's very, very important. And in order to increase the calcium uptake, you should also take vitamin D, magnesium, and zinc. Now, how do we get these things? How do we get all of these things? Well, we're talking about diet, right? So calcium is increased in several foods. It's increased in peas, beans, things like leafy green vegetables, fish and seeds, nuts, yogurt. There are so many things that we can eat to increase our calcium. Your vitamin D. Vitamin D is sunlight. If you are out in the sun for an hour or two a day, you probably have captured enough vitamin D. But if not, think about fish oils, or certain cereals may have vitamin D in them as well. Magnesium is in things like whole grains, the leafy green vegetables again. And zinc is very important. It's in liver, eggs, poultry, and seafood. So these are very important as far as your calcium is concerned. Hot flashes. Hot flashes is a part of menopause as well. Things like soy may help relieve some of the hot flashes due to menopause. And vitamin E is very important. It helps relieve the hot flashes as well. Try to limit spicy foods, because that may increase the problems of menopause. Caffeine, alcohol may all trigger hot flashes. Exercise is important. It helps the calcium be absorbed into the bone, so it helps prevent osteoporosis, or thinning of the bone, and it helps as far as heart disease as well. So these are some of the things that I would like you to think about if you're in that age range. All females that are in that age range of menopause, think about these things. They just may help. All right. We have an interesting topic tonight, one that may not be spoken of very often, but believe it or not, we have quite a few patients coming through the office with this problem. It's called scleroderma. And I have the best doctor in the world that I consider to talk about this particular topic. Her name is Dr. Wen Xiong, and she is a rheumatologist. Dr. Xiong, welcome to our show.
Thank you so much for having me here.
All righty. I'm so glad that you could come out today and talk about this very important topic, scleroderma. So I would like to just start off with my usual question. What is scleroderma?
Scleroderma actually comes from the two Greek words. Sclero meaning hard, and derma meaning is skin. So scleroderma meaning hard and thick skin. So it actually is referred to a group of conditions affect the skin, or underneath the skin there's some, like we call it connect tissues, which is support the inside of support the organs inside of the body. So the scleroderma means there's some skinning, some hard skin or hard, there's some like a thickening of the tissue inside the body also affect besides the skin. That's the scleroderma.
Okay, so what we're talking about is right under the skin there's a layer, what we call, doctors, we call connective tissue.
Right.
And that layer of whatever is laying right under your skin there gets hard.
Yes.
And if it gets hard, then it's not pliable. It doesn't stretch, it doesn't do very much, but it gets very hard under there. So it's skin, and then it's a hard layer.
Yes,
under
the
it.
skin underneath the skin, and then it's get thickened. We call it a particular layer of, sometimes we call it collagen. That's in the medical term. That's the where when we have a scar tissue, when we get injured a scar tissue, that's the basic of the scar tissue. That's a collagen.
So let's look at it this way. If I was to cut myself and it healed and there's a scar there, is that collagen that forms that scar?
Right. The collagen forms the scar to to heal the scar, to heal the wound, so it doesn't.
Right.
If it healed correctly, which is they're perfect. If it doesn't, if it overproduce a lot of collagens, then that's become a problem.
All right, and that's where this disease kind of starts coming into play.
Yes.
When you overproduce that collagen, that's similar, very similar to what a scar is.
Right.
Excellent, excellent. Now, you were talking about that other organs can be involved. And believe it or not, the skin is an organ, right?
Right. Skin actually is the biggest organ for the body, yes.
Oh, excellent, excellent. But so what other organs may be involved with this particular problem or disease?
So most commonly we call the heart, lung, and the kidneys, and also the digestive system. The digestive system is where the structure and organs we handle and process the food. Let's start from the stomach and intestines. So that's the most common involved for this condition.
Okay, so most in common. So let's talk about one of them. Let's talk about the digestive system.
Right.
And what we're talking about when we say as doctors, digestive system, we mean you eating some food,
Right.
you swallow it, and then it goes down this tube that's called the esophagus.
Right.
And then that dumps into your stomach, and then it goes into the small intestines. So that's what we're talking about. But what exactly happens to that? Does it have a problem moving the food along, or what actually happens?
So most common there's 3 problems there. The first we call acid reflux.
Oh.
So when there are a lot of patients with scleroderma commonly have this acid reflux, meaning the acid where supposedly normally in the stomach now backs up to the esophagus.
So that's like heartburn.
That's like heartburn.
Right.
So that's burning. That's gave you the heartburn. That's the most common problem. So the patient has a lot of heartburn. They couldn't really swallow. The second problem is difficult swallowing because the esophagus where supposedly send the food down from the mouth and going to the stomach, but because it becomes stiff, because there's collagen there, there's thick and stiff, and it doesn't send the food down there, and it's stuck there. So sometimes you feel the food is stuck midway from the chest going to stomach. It doesn't go down. That's what we call the difficult swallowing, and doesn't going down there. So the third problem is it may not absorbing well because there are a lot of problems in the stomach because it doesn't go down very easily. So there's the intestine doesn't move very fast as it's supposed to. So that's why they feel like a lot of time people feel nausea and the food doesn't digest very well, and it's just going up there. So that's what we call the difficult to absorbing, and there's some problem with diarrhea or nausea.
Goodness.
So,
now that is, so many people have, and the reason I wanted to pick that up was because so many people have those type of problems.
Yes.
You have a little indigestion, you have, your food's not absorbing, you're laying down at night, you kind of feel it backing up on you, but not everybody who has that problem has scleroderma.
Of course not.
Okay,
yes,
okay.
Right. So this is the one common problem, but the scleroderma is still relatively rare condition. We need as other condition, other symptoms to put together to diagnose this problem. So one of the symptoms is, yes, you're absolutely right.
Okay. So we know that, is there a reason, or have we as doctors figured out why this layer of tissue becomes so stiff and hard? Do we know what causes it?
So talk about the causes, we have to break down the scleroderma to two different main types.
Oh,
so one of the type we call there are two main types. One is called the localized scleroderma. Well, localized scleroderma is just only affect the skin or underneath the skin. So that's just overproducting collagen under the skin.
Okay.
So the systemic scleroderma, which involves organs, not just the skin. So when the systemic scleroderma, what happened is we don't know exactly what caused that, but we do know there's three processes at work to cause this. So one of this we call the overproduction of collagen, we call it fibrosis.
Right.
We don't know what the trigger. There's some cytokine maybe working, but some in a genetic background maybe produce some stress and produce some overproduction, but we don't know what triggered that.
Right.
So second process is we call it blood vessel abnormalities. So there's a narrowing of the small vessels in the digits, a small vessel, and then very narrow in the arteries of the lungs, and then that's called a blood vessel abnormalities. And the third process is we call it autoimmunity. What it is this is autoimmune disease, like we talked before. The autoimmune disease is immune system has a problem recognize itself as or as foreign body, so start to produce some antibody or attack their tissues itself,
right.
then causing the inflammation and damage. Those inflammation and damage that can actually damage some further in the organs. Sometimes it could be similar to other disease.
Okay.
So that's three processes going on there. We don't know how these three processes connect each other. Sometimes it's just independent going on there, so affect the different organs.
Oh, goodness.
So it's kind of it's complicated, but we actually a lot of scientists and medical. We did a lot of research actually to target a different process to try to stop or try to slow down the progression of this condition.
Okay. So let me just go through that. So I have I feel if I understand it, then
Right.
then it's good. Then we can. There are three processes.
Right.
The number one, well, the first process is the collagen under the skin, and that's where things get stiff, and the skin gets stiff, and it's taut, and it doesn't stretch, and that's why people have, very tight skin.
Yes.
That's the first process. The second process is that the blood vessels, and this is interesting, the blood vessels actually get stiff and narrow.
Right.
So the blood, when you start getting in your fingers and your toes, where the very small blood vessels, they don't get appropriate blood because the blood can't get through because it's so stiff.
Yes.
Alrighty. And the third is autoimmune, you said. Autoimmune is basically when we think about our bodies protecting ourselves. But for some reason, the protective mechanism for the body actually attacks the body
Right.
and causes disease. Excellent, excellent. So that's where we were as far as that. Tell me, as far as race, or well, let's talk about male, female. As far as females or males, who's more common to get this type of problem?
Women definitely more often to get this condition. It's a ratio from woman to men is about 4-to-1.
4-to-1.
Right.
So every 4 women can get it, and it would be one guy
to get it. Yes.
And what about as far as race is concerned? Is there any particular race, the black race or Caucasian or whites? Is there a race that's more prevalent with this disease?
For this condition, we really don't know the data where the white, or the African American, as we probably get the same. So prevalence is probably the same, but severity is different.
Oh.
So some of the Native American or African American actually have more severe disease than Caucasians.
Oh.
So prevalence is the same. They all get the same chances, but then this is more severe form or sicker when they get this condition in Native American or African American.
Okay.
Right.
So Native American, African American, sicker
Right.
patients
Sicker
with
patients
this
with this condition, right.
disease. Age. What age range are we looking for this? Is it very small kids, or is it, you know what I mean, or is
Right.
it really seniors that are going to get? Where is the population for this particular disease?
So for the localized scleroderma, which is only affect the skin or part of the skin, that's more commonly in children. So the systemic scleroderma is more common in adults.
Okay.
So in adults more often between the age from 30 to 50s. Right. So it's more common from 30 to 50.
Okay. How do another question, genetics. If your mom has it or if your sister had it, are you likely to get it as well, or should you be concerned about getting it?
Actually, compared to scleroderma, to other conditions we talked before, like lupus or rheumatoid arthritis, this condition actually doesn't have that strong genetic backgrounds. What that means is rarely people who have scleroderma have family member has the same condition. So they may actually have some genes which is put them susceptible for other conditions. Meaning the people who have scleroderma, they may have family member who commonly have other autoimmune disease like lupus, rheumatoid arthritis, but they don't have the scleroderma. So that probably happened. But normally this is not, we don't think this is a directly inherited disease.
Oh, okay.
Yeah, compared to other disease, like talk about diabetes, talk about the lupus, talk about other things. So this is less common.
Okay, all righty. Now, how would, for the most part, and I know that you see these type of patients all the time, more so than I would because you're a rheumatologist. How do most of these patients present to your office?
So if patient they have a tight skin, and then when they come to the first time we come to the door, you look at the face and look at the age, then you know they have a tight skin in the face, you know this patient has scleroderma because the age and the skin, they have tight skin in the face, so there's no wrinkle in the face at all. Oh. And they have small mouth. The mouth is small and the face is very tight, there's no wrinkle. Then you look at age, is like it's not normal. So then the first impression is the tight face.
All right.
And then when you look at the skin, you can find it. And some people, when they have a very tight skin, when the tight skin is involved all the way to the elbows, they actually have some, we call it very stiff fingers. They could not bend, they could not straight. Oh. So that's why make it like very stiff, and they could not close their hands, make a fist. Then you actually, just from looking, you know this patient has the scleroderma.
So that connective tissue, or that collagen that we're talking about tissue, it actually prevents you from moving your hands. It's that stiff.
Right. It's that how severe it goes. So the skin is so tight, it actually is not able to stretch around the joints, around their fingers, so they cannot close, they cannot open it, and they just stick to one place because the skin is just so tight. And so we call it contracture of their finger, meaning their fingers the joint is only stuck in one position. Right. It's not able to move it around. So that's how tight it can be. Sometimes you can see severe tightness. They can't even stretch. Extend the elbow, bend elbow that much. They have difficult to brush the teeth. They're difficult to comb the hair because they could not move with using the hands and using the elbow too much. So that's kind of.
So it restricts the elbows. It restricts the knees from bending to a certain degree.
Usually not much going to the knees.
Not
mostly
too much?
To the hands.
The
There's
hands.
most strand hands and some that go to toes and below the knees. So and going to the elbows you see more, but the knees probably not much. So there's different. Also there are different. We call it scleroderma-like. Symptoms, disease, actually sometimes you can see the more contraction. But with this scleroderma, you see it from the hands, can see it, right?
Okay, all right. You were talking earlier about other organs that may be associated with scleroderma. And you said something about the lungs, and that's my favorite organ, of course. You said that there's some scarring in the lung. Is the scarring the same? It's the same type of mechanism. You just get that stiff tissue within the lung tissue.
Right. So it's one of the mechanism. What happened? It is their collagen overproduction. Collagen does cause the scar of the lungs. Another things we talk about autoimmunity because it causes inflammation.
Swelling.
So, swollen. The swelling actually stimulates some of the cells, inflammatory cells. Okay. One of the cells we call fibroblast cells. And then when the fibroblast cells, that's one of cells, when they have overproduced those cells, they actually start produce the collagen. Oh. That's how this swell. In the beginning it's swell, and after that, then it becomes scar. And then when it becomes scarred, then it was reduced the function to breathing, so you can't really extend the lungs or expand the lungs to breathing, so that reduced the problem to ability to breathe in, and that's we call the fibrosis of the lungs, because the scarring has become more and more, and then we call it fibrosis of lungs. So the second process, another more important process is remember the blood vessels get smaller and narrow.
Right.
So when the blood vessels are getting narrowed, get stiff, then they can increase the pressure of the arteries of the lungs. Then we call it pulmonary hypertension.
Hypertension.
And
So
then,
that's high blood pressure
high
in
blood
the
in the
lung
lungs.
system.
So, which actually added the stress to the heart to push the blood flow forward. That's what we call the pulmonary hypertension. So that can cause a lot of the shorter breaths, and when you shorter breath. So that's one of the very important symptoms we have to deal with. It's a very challenging symptoms we have to.
Interesting.
Problem we have to deal with.
Yeah, because it just seems strange to me that I would think about scleroderma, but yet and still it affects the heart and the lungs as well.
Yes.
So basically what you're talking about is this collagen, and these cells called fibroblasts produce more collagen because of the swelling.
Right.
And that once that collagen, that stiff collagen gets into the lung cannot stretch like it. You know, the lung is like a balloon.
Yes.
When you inhale, it's like a balloon. The balloon stretches out. Well, it has elastic tissue in it. Well, this collagen, I assume, prevents that elastic tissue from stretching, so you can't take a deep breath.
Right.
Oh, goodness, then you get shorter breath.
Right, we call the lungs get stiffer and stiffer, and then it gets smaller and smaller.
Interesting. And the kidneys, I'm assuming something very similar. It gets a lot of that collagen in there, and it just doesn't function as well.
So the kidneys actually is more like the blood vessel problems, because
Right.
kidneys a lot of are small blood vessels.
Right.
So those blood vessels is they're getting narrow or stiff. It's because of inflammation, it's because swell.
Right.
So you may not see much of the collagen production for the kidney, but you see a lot of blood vessels get stiffer, and then so that's when the pressure is that's why the patient has the high blood pressure, difficult to control with, and then there's some leak of the protein from the kidney. So and then some severe form of their kidney problems, they actually end up like a sudden onset of the kidney failure that needed dialysis.
They need
so
dialysis.
That's how severe
Boy.
it can go. So that's the kidney is more like blood vessel problems.
Okay,
Right,
okay. Can you prevent it? What can I do to keep this from happening?
We actually don't know how to prevent
right.
it,
Okay.
because it's a rare condition, and
Right.
we don't know who's going to get it, who's not get it. So then we actually don't have the way to know how to prevent it.
Okay.
Right. So
There's something called Raynaud's phenomena.
yes.
Explain that, because I know that there are young women out there that have this happening to them, and they would really like to know. Tell me about this.
So Raynaud's phenomena, it's a symptoms when the fingers and toes turns to like a white or purple blue when they respond to the cold or the stress.
Oh.
So there's two types of this Raynaud's. One we call the primary Raynaud's. What happened is the primary Raynaud's is it's just symptoms. It's happened very early in the age, like even younger than 20 years old. Like a teenagers or women could have this these symptoms in the winters. And then we call the secondary. What the secondary means, this Raynaud's phenomenon actually associated with some certain disease,
Right.
like a Scleroderma. So those Raynaud's can be actually more severe form.
Okay.
So then those people, when what happened is Raynaud's phenomenon is caused by the small vessel becomes closed down or spasm. When
Okay.
they respond to cold, and it becomes that give you cut down the circulation of the fingers, then it becomes a problem.
So what actually happens is the blood vessels in the fingers and in the toes get very small. The blood really doesn't get out there. So if you go out in the cold, all of a sudden your hands turn blue.
Yes.
Or they get white very quickly, get cold.
Right.
All righty. Or under stress, you said it can happen
Can happen
as well.
under stress. So it's very dramatic. So the colors are just totally white, it's so pale or white, or just the blue. So it's very distinguished. It's very dramatic. So you can't really miss it.
Okay, all righty. We only have a few more minutes, so we're going to wrap this. How do you diagnose this? What can we do to diagnose?
So from there, you examine the skin, and then we do the blood works to checking for some certain autoantibodies.
Okay.
And then also we do the specific tests. Sometimes we may need to do a skin biopsy. We take the tissue from the skin sample to take a look, and also we do we also check the lung functions. We also do the echocardiogram, like ultrasound of the heart, to check the pressure of the heart. So
Right.
that's how we diagnose this.
Okay. And once it's diagnosed, do we have treatment for this?
We do have the different treatments, depends on how severe the condition is. Each person has a very different, some people can be mild condition, they may not need medication at all.
Right.
Some people can be very severe forms, then we need a different medication to treat the different symptoms like acid reflux, pulmonary hypertension, or kidney problems. So we have different medication to treat for the different conditions.
Different diseases.
Right.
Okay, all righty. And you talked about the females, but do males get this at all?
Yes, we do have male get this. Yes, we do have. I do have a couple patients with male patient in.
It's not that common, but they do come in the office every once in a while.
Yes.
All righty. All right. Excellent. Well, this is such a interesting problem, and I know in my practice I have several patients that have scleroderma, and they're very interesting patients because they have the lung problem.
Yes.
I see them and they come in with the shortness of breath, and then they have the high blood pressure in the lung system, and it makes it very difficult for them to take deep breaths and get enough oxygen into their blood so that they're not short of breath.
Yes.
Well, thank you very much for coming in.
You're welcome.
This has been an interesting topic. I know that a lot of people are going to look at this because the symptoms, how many times have I gone outside and shoveling snow and my fingers turn blue? So now I know the blood's not getting down there appropriately.
Right.
But thank you very much.
Thank you.
All
I
right.
really liked it.
Okay, well, as far as closing is concerned, remember, sharing and caring. Share your medical information, the good things that you know about your medications, your particular problems. Basically, what we need to do is go and share with each other so that we can better take care of ourselves. All righty. Never institute any change in your medical care until you go see your doctor. All righty. I trust that each and every one of you have continued good health. I'm Dr. Obey, and this is A Moment in Medicine. Until next time, peace to you all.